Hi, everyone. Welcome to WIC 101. Learn the basics and how you can be an advocate for WIC, hosted by the Food Research and Action Center. I'm Steve Hayward, FRAC's Communications Manager. Before we begin, I'd like to cover a few brief housekeeping items. We expect this webinar to run about 60 minutes. We are recording the presentation and will send the recording and slides in a follow-up email. Closed captioning is available. To turn captions on, select Show Captions in the bottom taskbar and select English as the spoken language. We'll have time for questions and answers at the end of the presentation. To ask a question at any time, please use the Q&A tab, also in the bottom taskbar. With that, I'll pass it off to Kate Scully, WIC Deputy Director at FRAC. Take it away, Kate.
Thank you so much, Stephen. Good afternoon, everyone, and thank you for joining us for a discussion about the Special Supplemental Nutrition Program for Women, Infants, and Children, or as we all know it, WIC. Today, we'll be providing an overview of the program, some of its key benefits, and the current need to protect and opportunities to strengthen the program. If you have a moment, it would be great if you could tell us who's on this call and share your name and where you're coming in from in the chat as we get started. All right, next slide, Stephen. Awesome. So FRAC has a long commitment to the WIC program, having advocated for it to get the funding it needed from the very start. As we continue to fight for WIC, we are here to provide guidance, technical assistance, and general support for your efforts to advocate for the program at the state and federal level. And today I'm really excited to be joined by two of my FRAC colleagues. First, we have Susan Bodine, who is the Senior Program Manager for WIC, and she'll be providing an overview of the program. And then we have with us Ellen Teller, our Chief Government Affairs Officer, who will be sharing actions you can take to support WIC today. So I'm going to hand things off to Susan to get us started on some of the specifics on WIC.
Thank you, Kate. So as Kate mentioned, we're talking today about WIC, and this program provides pregnant and postpartum individuals, infants and children up to age 5 with nutritious foods, education and counseling, and referrals to healthcare and social services. And to show kind of the breadth of the program, nearly 40% of all infants in the United States benefit from WIC. Next slide, please. All right, so WIC is available across the United States, and the program's administered at the federal level by the US Department of Agriculture, operated by WIC state agencies, and these include state health departments across the 50 states, and the District of Columbia, 32 Indian tribal organizations, and 5 territories. And in the community, services are provided by entities such as county health departments, hospitals, schools, and more entities that serve as local WIC agencies. In terms of funding, WIC is a discretionary program, meaning that Congress has to authorize a specific amount of funds for the program each year. And it's really important to ensure this program has sufficient funding to meet program needs and rising food costs. And there'll be more later in the webinar about that. Next slide, please. All right, so to participate in WIC, folks are looking at 4 different sets of criteria. So number 1 is participant category, and that's whether the applicant is pregnant, postpartum, an infant, or a child up to age 5. And for infants and children, their caregivers, such as fathers, grandparents, foster parents, can also apply for them. And one important feature about WIC is there's not a test related to citizenship or immigration status to participate in the program in nearly every state. Criteria 2 is whether the applicant's income is below 185% of the federal poverty level, or if they have adjunctive income eligibility based on participation in other key programs that are means tested. Category 3 is whether the applicant is deemed to be at nutrition risk. And this could be a medically based risk, such as anemia, or it could be a diet-based risk, something like inadequate dietary patterns. And this nutrition risk is determined by a health professional that's often a staffer at the WIC clinic, like a registered dietitian. And it's really rare for someone to be excluded from WIC because of the nutritional risk requirement. criteria for whether the applicant is in the proper WIC jurisdiction. So to apply for WIC, you're going to visit their local WIC agency or apply online, depending on the system. It just needs to be the right place based on where the person lives. Next slide, please. So the greatest WIC tongue twister. In the last slide, I mentioned something called adjunctive eligibility when it comes to the income requirement for WIC. This just means that the applicant is considered to be automatically income eligible for WIC because of participation in Medicaid, SNAP, or TANF. And in a couple of states, you can also look at Head Start for adjunctive eligibility. And what's key to know about this mechanism is that it helps to streamline the process for the applicant and for the WIC agency. Next slide, please. All right, once they're enrolled, WIC participants receive a host of important services. WIC provides nutritious foods, breastfeeding support, nutrition education and counseling, and also screening and referrals to other health and social services. And these WIC services are provided by qualified professionals such as registered dietitians. Next slide, please. All right, a bit more on the nutritious foods component of WIC. So WIC provides supplemental foods that are designed to address the specific nutritional needs of participants. These foods are provided via a monthly benefit for one of 7 science-based food packages. And the specific package is assigned to a participant according to their life stage nutritional needs. And these food packages include foods like eggs, whole grains, beans, cereal, milk, yogurt, infant foods, or infant formula. And WIC guarantees a specific amount of each food. So for example, 1 dozen eggs, with the exception of the fruit and vegetable benefit, and that has a cash value and allows participants to select which fruits and vegetables to purchase. And these participants' food packages, the benefits are loaded onto a WIC EBT card, and that's used by the participant to purchase approved foods at WIC participating grocery stores and other vendors. And these benefits must be used in the period they're provided for, and so they don't roll over like SNAP benefits do. And these WIC food packages were updated by a rule released last year that made improvements in a host of areas. So these updates enhance equitable access to nutritious foods, improve the nutritional quality of the foods offered, maximize food choice to reflect dietary guidance and accommodate cultural and individual preferences, and make WIC more participant-centered. And of central importance, this update made permanent the increase in the funds available for fruits and vegetables. That cash value benefit for fruits and vegetables increase is already in effect across the country. And then for the other components of the improved food packages, some states have started to implement those, and all states have to have them in place by April 2026. We have a great toolkit linked here you can use to spread the word about the food package improvements. And now I'll hand it back to Kate to dig in a bit more on the cash value benefit piece.
Awesome. Thank you so much, Susan. As Susan left off on the food package and talked a little bit about the cash value benefit, we wanted to focus on that and also the Farmers Market Nutrition Program, just to give you a little bit more detail on those 2 pieces. So as Susan mentioned, WIC participants are given a cash allotment to be able to purchase the fruits and vegetables they want at any approved WIC vendor, which could also include their local grocery store. This allows for them to purchase beyond just prescribed products, and provides flexibility and choice in the process. Families can buy their fruits or vegetables their child likes that week or select items familiar to themselves and their culture. And here you'll see in the chart that prior to the pandemic, the cash value benefit was valued at $9 for children and $11 for adults. This was paid to them monthly. And then as part of the American Rescue Plan, Congress increased this amount, and after seeing the positive impacts, made them permanent as part of the 2024 food package revisions. So currently households receive $26 for children and between $47 and $52 for adults, which is an incredible improvement and something that we are keeping a close eye on and want to make sure stays at that level. This increase has been shown to improve nutrition as families have access to additional fruits and vegetables. reduces food insecurity as it's bringing more food into the households. It also supports local grocers and farmers as more products are being purchased, and encourages WIC participation as it makes the package in general more appealing. And then the other program, the Farmers Market Nutrition Program, I was getting confused by the two, so just wanted to pull this out for you all as well. So this program was established by Congress in July of 1992, and the purpose was to provide fresh, nutritious, unprepared, locally grown fruits, vegetables, and herbs. And then people can purchase these at farmers markets or roadside stands. States receive grants for this program and then provide coupons or checks to WIC participants to use at those approved farmers markets or roadside stands. So you can't use this at a grocery store. The federal benefit level, whether it's for a household or an individual, must be at least $10 and cannot be more than $30 per year. So it is a smaller cash value as well than the cash value benefit. And then some states have supplemented the federal benefit with either state, local, or private funds. So while the cash value benefit and farmers market nutrition program are similar, there are some differences we just wanted to highlight here. All right. So now we have a basis of what WIC is. I wanted to spend some time going over some of the incredible benefits of the program. So WIC has been proven to be one of the nation's most successful and cost-effective nutrition intervention programs. Since its beginning in 1974, reviews and reports demonstrate that the WIC program is cost-effective in protecting or improving the health and nutritional status of pregnant and postpartum individuals, infants, and children. So some of the proven outcomes of WIC include reducing food insecurity and alleviating poverty, a greater likelihood of prenatal care, improving birth outcomes and overall health outcomes, improving dietary intake, protecting against obesity, and improving cognitive development, leading to greater achievement in school. As you can imagine, first years of life are when a lot of development is happening. And so by getting this nutritional benefit during pregnancy and then in those first years, it really helps solidify the building blocks that kids need to grow and learn. And so all of the benefits of WIC also lead to the overall reduction in healthcare, educational, and other costs, making the program truly an investment in maternal and child health and well-being. A 1992 study found that for every $1 spent on WIC during pregnancy, the Medicaid savings during the first 60 days of life ranged from $1.77 to $3.13. So for $1 invested, you're getting that return up to $3.13. And then a more recent study found that for each $1 in spending on prenatal WIC services resulted in Medicaid savings ranging from $1.24 to $6.83 due to those improved birth outcomes. So imagine that $1 investment could be almost $7 in return on savings from other healthcare costs. And the benefits don't stop there. WIC is not only beneficial for participants, but also for the local retailers, farmers, producers, and distributors that get the benefits. In 2024, WIC participants spent nearly $5 billion at their WIC-approved vendors, providing a boost to those local economies. So these are just some stats you can use in all your Hill visits on WIC. And then who is participating in the program? So this is the latest data. The most recent national participation numbers for the program show that 6.7 million pregnant and postpartum individuals, infants, and children are participating in the program. And generally, we see that pregnant and postpartum individuals make up about 30 to 35% of those participating. Infants are the largest group, making up 40 to 45%. And then children ages 1 through 4 make up about 20 to 25%. And then the nationwide average monthly participation of WIC, you see from the fiscal years we have listed, has increased between 2022 and 2024, rising most rapidly in 2023. However, despite the overall increases, there are states that did see a decline in the program, showing the impact state policies and practices can have on people connecting to the program. The USDA does have information on participation by state, which is important as states do have discretion on how they operate the program. And then we have to talk about the participation gap in WIC. So despite the positive overall trend, only about half of eligible people are participating in the program. As the most recent data, approximately 1 in 4 children in the United States are eligible for the WIC benefit. However, not all eligible children participate in the program due to various barriers, including those related to awareness, access, and stigma. Some stats for you all to have is 78.4% of eligible infants participated, but only 46% among children ages 1 to 4 did. And then we have more than half of WIC eligible people enrolled in Medicaid or SNAP did not access WIC despite being income eligible due to that adjunctive eligibility connection. So there's a lot of work to be done. And to do so, we really need to address some of those barriers that people are facing. So what are the barriers so we can address them? The underutilization of the program doesn't have a single cause and has occurred despite adequate funding to serve all eligible applicants for more than 25 years. So some of the things that we see as barriers to the program are that people don't know that they're eligible, that they have difficulty getting to the WIC office for either their certification, recertification, or if they need to do the nutritional assessment. The time it takes to apply, the paperwork you have to provide, and sharing information about adjunctive eligibility hopefully can help diminish some of that misconception and make it easier for folks to apply for the program. Not everybody loves the WIC package. Not everybody wants to be prescribed what they're purchasing, so that can lead to some dissatisfaction with the program, or if there's limited availability of those WIC-approved foods at their local stores. So all of this can make it difficult for people to participate in the program, to stay participating in the program, and is something that we are all working to try to close. And then some ways we can close that participation gap. And there's efforts happening now. We've got efforts to modernize the WIC services that include mobile apps, online appointments, online shopping, increasing outreach in underserved populations, reducing stigma through education and community partnerships, and expanding access through clinics in hospitals or mobile WIC units. And we hope that all of you can help kind of spread the word about WIC. Here on this website, we have, or on this slide, we have the WIC pre-screening tool from the USDA that can be used to assess someone's eligibility for the program. We have resources at FRAC. Susan, I know, shared in the chat already, a great toolkit to share information about the increased food package to let people know how important and beneficial the program is. And then we have listed some of the great partners that really work with populations that could be eligible for WIC to try to connect with them, to help use them as trusted agents to tell people about the program. So I'm going to now turn it over to Ellen Teller so you can use all this information in all of your Hill visits.
Great. Thanks so much, Kate. And I just have to say, I lobby on SNAP, I lobby on all the child nutrition programs, but WIC definitely has a special place in my heart. It has a very interesting origin, and I'm going to actually digress for 30 seconds to tell you the story. It was in Shirley Chisholm's memoir. So Shirley Chisholm was the first African-American woman elected to the House of Representatives. And as she stated in her memoir, as punishment for being the first African-American woman elected to the House of Representatives, she, a member from Brooklyn, New York, was assigned to the Agriculture Committee. And immediately she thought, what am I going to do on the Agriculture Committee? We don't grow a lot in Brooklyn. And at the same time, there was the White House Conference on Hunger. And so she went to the conference, and on the bus back from the White House to the Hill, she ended up sitting next to a new junior senator from Kansas, Bob Dole. And the two of them were talking about how they were seeing a high rate of infant mortality and problems with pregnant women, and a lot of concerns about the health and welfare of women with low incomes in their district and state. and they committed to working together. And to make a long story short, they worked together on the establishment of WIC. And, you know, it's sort of interesting, a Republican senator from Kansas and an African-American woman from Brooklyn, New York come together, and they start the WIC program. I wish Congress was sort of reminiscent of those days these days. All right, now you know the interesting history of WIC. The committees of jurisdiction for WIC are different than that for SNAP. For those of you who work on SNAP, you know it's the House and Senate Ad Committees. Over in the House of Representatives, the jurisdiction for WIC and the school meals programs is in the House Education and the Workforce Committee. When the Democrats are in the majority, it's also known as Education and Labor, but now it is Education and the Workforce. These are the leaders of those two committees. And I have to say, the wonderful thing about WIC is it usually enjoys a bipartisan support in the Congress for so many of the reasons that Kate and Susan mentioned before. Let's go to the next slide. So there is legislation that has been dropped now that would improve WIC. I just want to state that the reauthorization of the child nutrition and school meals programs is not on deck right now in Congress. The last time we reauthorized those programs was in the Healthy Hunger Free Kids Act in 2010. So we are long overdue for reauthorization of these programs, but there hasn't been, and you'll hear this consistently in our presentation today, there has not been funding available to improve these programs. And especially for the WIC program, it's difficult because unlike just about every other nutrition program, WIC is not a mandatory or entitlement program. Entitlement programs are programs like SNAP, school meals, Social Security, Medicare, where if you are eligible and you apply, you get benefits. That's it. Whereas WIC is what we call a discretionary program. That is, Congress gives it a certain amount of money based on what they anticipate the needs would be, and they fund it according to that. If the money runs out, and we'll get to that in a minute, then state WIC directors have to implement certain safeguards to make sure they don't overspend. And that is a fundamentally, structurally difficult part of WIC, which we'll talk about in a minute. The upside of COVID, we learned a lot about delivery of programs during COVID. And one of the things we found out about WIC is allowing remote access to WIC really made it substantially easier for parents to access the program. And I love going to WIC clinics because they're very nurturing and friendly and welcoming types of offices. And I get a chance to talk to a lot of people who are on WIC. And over and over and over again, and Kate got to this, what we hear is that I'm at work, I have to go pick up the kid at childcare, I have to go to the WIC office, then go back to the childcare, drop off the kid, and then get back to work. And my boss lets me do that only so often, but I don't get paid for the time that I'm commuting back and forth to the WIC office. So you can see how the physically present requirement could be a real hardship and a real barrier for a lot of women to stay on the program. As Kate mentioned, you know, we see drop off as children get older. The WIC, the modern WIC Act, which has just been introduced, would allow that remote certification and remote access to be embedded in the program rules and regulations. And it would just lift an enormous barrier to access to the program for many parents with low incomes. Next slide. Thank you, Kate, for putting that in the chat. There are definitely ways we want you to engage with your members of Congress to support these bills. As I mentioned earlier, WIC is not like other nutrition programs. It is a discretionary program. It is subject to annual appropriations. And although in the past, once the administration documented what the need was, it was almost routine that the House and Senate Agriculture Appropriations Committee would pop that number in. What we always have to be mindful of is that because WIC is a set amount of money and it is driven by participation and the cost of the WIC food package, it's really important that we provide enough cushion to allow for food costs to rise or participation to swell. And as we see cuts to other programs, we can anticipate we're going to see more people coming into the WIC program. So we always have to monitor to make sure that the funding keeps up with the caseloads and food costs. Yes. Next slide, please. So this is our technical appropriation ask, and that is we want to make sure that WIC is funded at a level that would ensure that every eligible person who applies for the program can receive the benefits. And we always urge USDA, which has a sort of jurisdiction over WIC, to just continue to monitor the trends to make sure that we hit that number right. There are some set-asides in the WIC appropriation that we also want to make sure gets funded. They're listed in the slide. These are critical services that are provided for WIC. I think it's really important to note that the WIC food package is just one piece of WIC. It's these support services that really create that welcoming feeling when you walk into the WIC office, and that really provides an incredible support for WIC parents. I can just speak personally that breastfeeding doesn't always come naturally after you've had a child, and it can be incredibly frustrating and stressful on a new mom when it doesn't just happen naturally. And getting that breastfeeding peer counseling and just reassuring that mom that we can work on this together, it's really a game changer for someone whose hormone levels are already through the ceiling. So, and then there's always, you know, the infrastructure support and making sure that WIC continues on its trajectory to modernize. I remember when we were dealing with the WIC coupons, and now, you know, we have WIC electronically through an EBT card, which has been wonderful in terms of the modernization of the WIC program. And then there's also the WIC Farmers Market Nutrition Program that Kate talked about to make sure that it gets funded. And the Farmers Market Program and the voucher program are two ways in which the authorizing committee, which is the Agriculture Appropriations Committee, I should say, really gets the connection between WIC families and fresh fruits and vegetables and all the commodities that we want to make sure get into the bodies of WIC participants. So it's really a wonderful connection between the two. I think that might be my last slide. Is there another one after this? Nope. That's it.
Do you want to make a mention about reconciliation? I know we don't have a slide on that, Ellen, but WIC is indirectly impacted potentially.
Yes. So as you know, Congress right now is going through a major reconciliation effort. Just last night, the House Agriculture Committee voted out its reconciliation bill. The Energy and Commerce Committee reported out its reconciliation bill, and they have jurisdiction over Medicaid. And then the Ways and Means Committee reported out their tax cut portion of the reconciliation bill. And when you take the SNAP and the Medicaid cuts together, they are just disastrous for WIC because, as Kate mentioned earlier, there is this adjunctive eligibility for SNAP, for Medicaid and other programs to get people quickly into and seamlessly into WIC. And when you see cuts to those programs, that streamlining effect gets jarred, and it really erects additional barriers for people to get into the program. And so that is a huge concern to us. And we also have huge concerns that cuts to SNAP could impact children's access to school meals, summer EBT, after school programming, and impacting the child and adult care food program. So there's a lot of concern in reconciliation on how it impacts child nutrition programs and school meal programs, so much so that the ranking members of both the Education and the Workforce Committee and the Budget Committee, Mr. Boyle from Pennsylvania and Mr. Scott from Virginia, wrote to the Speaker of the House and said, before this bill goes to the floor of the House, we need to hear what the impacts are going to be on child nutrition and school meals programs. So there's definitely a lot of concern there, Kate.
Yeah, thank you for sharing that. As some of you may have received, FRAC is doing an impromptu webinar tomorrow to discuss that very thing, just because we know it's a hot topic and something people have questions about. So I think it's at noon tomorrow, and we'd love for you all to join that as well. So this slide is just a list of a bunch of our resources on WIC. We've put a lot of them in the chat. We'll make sure to include them in the email we send. But I do want to put a plug. Susan and I are here to churn out resources. So if you need something for your advocacy, if there's a question you have, if there's resources you need, please let us know. We want to be allies to you all and help support you in supporting the WIC program. So let us know what we're missing, and we will work our magic to make it happen. And then on the last slide, we have Susan and my email address. So that's how you can get in touch with us and let us know what you need and how we can help, and also what you're seeing in your states when it comes to WIC, because we know there's so much differences in the states on how they implement the program. So go ahead.
I was just going to say, there are some questions, and one question that was levied to me. There are other questions for you and Susan, about immigration status in WIC. Yes, there is a lot of concern about it. Much like the child nutrition programs, there is not a citizenship requirement currently for WIC. And we are very concerned that some of the drop in participation may be to the sort of fear factor of people nervous about going and accessing WIC. I will tell you, in the House Agriculture Reconciliation Bill, they stripped away SNAP participation for asylees and refugees, and which was just heartening, just heartbreaking, not heartening, heartbreaking to see. So we are watching this closely. As I said, WIC is not up for reauthorization. And one good thing is that the House Education and the Workforce Committee was given reconciliation targets, $330 billion in cuts. Unfortunately, most of that went to higher education grants and loans programs. And we were afraid that the Budget Committee chairman at one point had a proposal out there to increase verification in school meals and to weaken the community eligibility provision. We didn't know if there would be efforts to do other changes to school meals programs. WIC would not be hurt in a reconciliation bill because it's a discretionary program, and they don't target discretionary programs in reconciliation. They are the mandatory programs, which is why SNAP had such a big target on its back. But we are very much not only watching the federal government, but as you probably have heard, there have been efforts in the past where state governments, Indiana for one, tried to put in that restriction to only citizen parents participating in WIC. And of course, the Supreme Court is looking at the birthright citizenship case as well. And it has been longstanding that children born in the United States are citizen children, and therefore there's never been an issue with the kiddos' participation in WIC.
Yeah, I think unfortunately everything related to immigration is scary right now. And so if you're hearing things in your states, that's something we want to track and hear about, because we are seeing some actions to take WIC away from immigrant populations, which is just so disheartening. So please be in touch with us about that. I'm seeing some additional questions around a proposed increase for WIC allocation and whether that's moving forward. There was the increase in the cash value benefit, and WIC has received the full funding that it needs to operate to serve all projected caseloads for the last 25 years. We did have that funding fight last year where we weren't sure if WIC was going to start having to implement waiting lists. And so we are keeping a close eye on fiscal year 26 budget. Of course, nothing was included in the skinny budget about WIC. However, we have heard rumblings that there might be a proposal to cut that cash value benefit back to those pre-pandemic levels, which would be an overall cut to the WIC benefit for families. So that's why I wanted to make sure to highlight that program today. It's really critical and important. I don't know what you can buy for $9 when it comes to fruits and vegetables. And so we really want to make sure that those increases, which are scientifically based, are kept at the levels that they're at today. So we will be closely monitoring any budget proposals that come out to push back against any of those cuts. And then, Ellen, there's a question here about the SNAP skimming problems and if WIC sees similar theft problems. I have not heard that at all.
Now, we heard some with summer EBT, not to the extent of SNAP. And I will say that one of the reasons why, because summer EBT and WIC benefit amounts are minuscule compared to that of a SNAP household. So maybe, that could be one of the reasons why it's just not as big, but we haven't heard as much about that. And Kate, there is no chip technology embedded in the WIC EBT card, is there?
No,
I know,
not,
yeah, there are states that
okay.
are working on it for SNAP.
Mm-hmm.
Oklahoma and California being the top two.
Yeah, and I wonder, WIC, you're not, except for the cash value benefit, you're getting a dozen eggs, or it's more item specific. It's not like money on the card necessarily. So that might also be a reason why people, when you go to skim, it's not the same. But this is a question I do want to take back to the team and make sure that we're not missing something that might be happening.
Yeah, and actually you may want to talk to Salam, our SNAP director, who's working on chip technology with Mr. Wyden and Mr. Fetterman, Senators Wyden and Fetterman, who have the SNAP legislation in the Senate requiring chip technology. You're right, WIC is different because it's not a dollar amount on the card. It is a product on the card.
I'm looking at, Susan, are we missing any questions in the chat?
I believe we've gotten through all of them.
Okay. Does anybody have any other questions you want to pop in the Q&A or in the chat, and we can make sure to answer it?
So the only thing I would just add, Kate and Susan, to this conversation is that it is a wonderful opportunity for you to invite your members of Congress to join you in a visit to your WIC clinic. Summer food and WIC clinics are like my two favorite places to bring members of Congress, just because it's so loud in school cafeterias and it's bedlam. But in a WIC clinic, you know, the members walk in, there are all these like posters up on the walls. The staff is just inviting. You don't have posters up there that say, you know, if you participate in fraudulent activity, you'd be subject to prosecution. I mean, it's just a very different feel in the WIC clinic, talking to the folks who work there, talking to the people who are there for WIC benefits. They can tell members about the services they're receiving and just how zen the whole atmosphere is and how warm and welcoming. So it is a wonderful place to bring a member of Congress, but work with your local WIC agency, and Kate and Susan can help you put that together. We have some resources on the FRAC website about how to arrange a site visit with your members of Congress.
Yes. Well, this was great. Ellen and Susan and Stephen, thank you all for your time and effort in this. I've been at FRAC only 3 months now, so this is like the start of hopefully a webinar series on WIC. So if there's topics you want to discuss on the program, feel free to let us know and we can do a special webinar on it. You're an expert on WIC and want to share that with the group, we want to hear from you and happy to highlight you and the work that you're doing. So you have our email addresses. We'll send around the webinar recording as well as some resources that we shared today. Don't forget to email your member of Congress about the Modern WIC Act and to reach out to them through this reconciliation process and really let them know that this will hurt kids and will increase hunger in this country. Any other final thoughts from the panelists?
No, but I wouldn't be surprised if your member of Congress participated WIC as a child or as a WIC parent. It's always fascinating to me to hear stories. And the chairman of the House Ag Committee, G.T. Thompson, was a WIC parent, and he's also on the Education and the Workforce Committee. So always good to know that.
Yeah. Any final thoughts, Stephen? Things people need to know?
Nope, nothing from me. That was a great webinar, and check our website, frac.org/events, for all of our upcoming webinars, and I'll pop that in the chat. Thanks all.
All right, great. Thanks, everybody.
Bye-bye now.